agenda. No, just joking. Absolutely.
Okay.
No, certainly want to be dynamic and meet your needs.
Did we have anyone else say that they would be able to attend? I know everyone is feeling very knee deep in stuff right now.
Let me just check for you. There were lots of people who didn't respond.
That happens as well.
Yes, but oh my God, now the computer's back. Okay. We had Ryan say yes, Ryan Cummings. Young Lee said yes, Harmony, Caitlin, Stacy, Maricel, Rebecca.
Maricel, is that her new address? Did you?
Yes, I did include her. Yes.
Thank you very much.
I sent it to her personal, and then she says, can you change that now? I've got a Lumio address. So then I sent it to her Lumio address.
That's awesome. Well, we'll give one more minute and then we will jump in with both feet. We'll buckle up for a bit of a car ride. A good car ride.
Yeah, they're usually good car rides, right? Unless you're a pet going to the vet.
Well, fall colors are out right now, but we do have 3:05. And in interest of time, what do you think we should probably get started and we can catch anybody up? So I've got the agenda up and, just a quick round table on how everybody is feeling about all things Lumio. And if you have anything to report. So I don't know who would like to go first. I know, Harmony, you probably have a lot to report after this week. I saw you kind of straighten up there. So maybe we'll start with Harmony.
Yeah, sure. It's been a week. We are in our second week of testing, I guess, as far as the RAI goes. So we're still hammering out some bits and bobs with that as far as mid-2020 and HL7 go. But we'll get there. Team's driving forward. Yeah, I think other than that, I look forward to seeing the LTC admission workflow from Sebastian.
And it looks like Caitlin is on the phone. So we will just give her a moment. And then Sebastian, do you want to go next or should we ask Caitlin? Up to you.
Happy to go next. Introducing self. I was multitasking and you didn't catch me.
You're eating soup. I'm just teasing.
Soup. Trying to keep my immune system going strong here. Yeah, glad to be co-chairing with Laura. Certainly looking forward to, as we transition closer to the go live, to finding a co-chair to continue on in as I depart the project and stuff. I'm really glad to be working with the team. We work really well together and look forward to showcasing the ongoing parts of the admission workflow today, and have done my best to synchronize it with Harmony and what she's been teaching with Young Lee to align with also the workflow that was signed off by the by the project as well prior to me joining. And I think our Med 2020 testing is going, and I think we have our eyes open and we're really being mindful of that as well and navigating and pushing forward to the best of our ability, and grateful to be again working with such a good synergetic team.
Caitlin, do you want to jump in next? What's top of mind and how are things going at the home?
Well, we've received feedback, like some of our registered staff who have completed their education, and some of them have mentioned that this is really a bigger picture to residents' profile. There are some concerns that they feel that it might be too much for them, and we mentioned that the support will be provided for them. And I know Harmony, Young Lee, and the team has been really, really supportive during the training. So it's a change, but definitely the support is there. Yeah.
Well, thank you for being such a good change champion. And we're fortunate too to have Harmony and folks like Young Lee, Kaylee, really strong people within the home. Actually, I would say anybody that generally attends this call is a very strong change champion and very positive, or always has been in our meetings. I was going to say, Becky, do you want to go next roundtable of top of mind topics and how things are going, all things Lumio for you? You're on mute. No, maybe she had to step away. That's okay. I can go next. As Sebastian said, we're knee deep in Med 2020 testing. I'm really enjoying the operational role, getting lots of training. So learning a lot of the tools on the back end and really starting to feel a bit of a groove with that. The other thing I did want to say to this group is Lizetta has had confirmation that we're able to give some time back to you for the month of December. So we will be canceling the working group meetings for that time, understanding that the attention and focus needs to really be at the home and the transition into, Lumio in our next phase and stage of development. So Becky, I don't know if you want to finish off the loop.
For witness, or is it for?
She's having camera and mic issues, Laura.
Shoes. Perfect. Oh, thank you. It seems to be a familiar flavor lately with MS Teams, so I'm not too unsurprised. And Lizette, is there anything that you would like to share as well?
No, just echoing what you said, that I have been in the midst of trying to cancel some of those change management meetings, not just for long-term care, but for our other groups, so that we can focus our attention on the go live activities. And it's been busy, but it's been a good busy. So I really appreciate being part of all of the groups and learning a lot as I am nearing the end. Oh God.
Yes, you'll be able to go back to Providence. That's kind of wonderful news, actually.
It is, but I've enjoyed so much this experience that I keep trying to convince people to just prolong it for another 3 years until I retire. But nobody would like to take me up on that offer.
Caitlin wouldn't want to hear that because we all have to start paying for this project. Becky, how are you doing now with your computer issues? Still. Oh,
We just lost her again.
we just
Yeah.
lost her again. Well, maybe we'll jump into our next slide is really around the process for asking questions. I think again, it always feels like we have a little bit of a different, oops, wrong screen, a little bit of a flavor when it comes to LTC and how we do things. I think we're a little bit more plugged in, I like to think, than some of our other groups. However, this slide was developed project-wide to kind of keep us on track that if you have questions, I hope, Caitlin, you feel supported. You do have the wider team and you are very plugged into those individuals as well. So I'm not too fussed that way. I think you have a good handle on those things, or I feel that when you've had questions in the past, you've known where to direct them to. But just keeping in mind that there is an even wider and bigger circle behind Harmony helping to support her. So going into the next phase and as we're going forward, Go Live is really just the start of the journey. As it talks about, there's going to be some issues and the system itself is going to evolve and change. There will be change requests, which, we've had those with the LTC group, so that's nothing really new, but we are going to have to take a little bit of a stabilization time, which again, not really anything new because we did that with Medicare as well. And then we're starting to put some of those changes in for optimization. Caitlin, you may recall some of the things that we had on that docket were like the push tool. And some of the IPOCs, we made a conscious decision to not go forward with them at the time, knowing it was going to be a change request, but we did have those itemized on the optimization list. And Sebastian and Harmony are going to be working to flesh that out going forward. I think we all know what optimization is here, but it's really once the system has had a chance to sort of level set and settle, and people have had a time to get used to the massive change, really, and get used to the system. I have had several projects I've been PM for. I do find the optimization things, usually it's about 10% that we want after that stabilization period, or they've changed. So we know of a better way of doing things. And the way that businesses and organizations run all also have a tendency to change. And that too has to be factored into some of those items that we need. We know the ministry comes out with new asks and things that they want, especially through their audits. And I think those are the types of things that really make us pivot, that will hit that list and be more likely to get done sooner because they're more current. So we will work after go live to make sure that everything is kept up to date and we know exactly what it is that we want to make with changes to the system. If you have specific questions with workflows and working groups, obviously we can go to the Lumio library, which you've been orientated to. And of course, you're always welcome to bring those questions to the working group. And I really see this structure continuing to grow and be more of a decision-making body and a problem-solving body going into the next phase after go live, because we will be doing change requests and they're going to have to come somewhere for a fulsome discussion on how it impacts LTC. So I think all of those things are really good things coming up on deck. And I don't know, Sebastian, is there anything else that you can think of? And you've got a lot of experience with Island Health in this phase that is very real and can contribute. Is this kind of what you've seen as well?
Yeah, yes, for sure. And, I think my experience with Island Health, we took all the tickets that came in as like feature enhancements and they sort of just stayed and they just sort of stayed at the bottom of the pile, and bigger priorities, to your point, Laura, came to the top. And then it was just navigating through them, prioritizing them. And I think something that I really like, and from a Canada-wide perspective, is the establishment of these working groups demonstrate maturity in the organizational level. Like at a HIM level, it's quite a mature state. So I think that's really good to have these standardized decision groups and having the ability to escalate them to other groups. So I think that's really in our favor, in your favor, the favor of the project as well. And I imagine, despite us collapsing or closing down or giving time back during December, Caitlin and Harmony, there's going to be a need to have an opportunity to come together to talk through decisions that we want to make in the moment, and to have that done in a formal process. And I've articulated that at some of the other tables that we get a chance to share input into, because they're going to have to make rapid decisions, possibly in the moment, and they might have impacts to us as we share a lot of the build with the INA group, the inpatient nursing sort of side of the house as well. So I think just be mindful of that. And then during that stabilization period, it'll be about triaging and bringing tickets forward and making informed decisions together, which I think is really powerful, because some of the past experience that I've had and have heard from other projects is things get done without stakeholders being aware. And so this is a way to also protect us and others.
That's a really good perspective. Any questions actually around that, Caitlin, or anything else that's been shared? Perfect.
No.
Well, our next agenda topic is actually going back through the highlighted workflow, the LTC admission workflow. It's quite fulsome, and Sebastian has put a lot of work and got a really good product, I think, for us to continue to have as an artifact. Sebastian, do you want to take it away?
I'd be honored, yes. Okay, so I've done, it's quite long. It's it's showing at 45. Okay, great. Good. Okay. We'll start it off. It'll wrap us up for today, which is good. But in essence, we started with the pre-admission. I think I talk it through. We start with the pre-admission, the 24-hour care plan sort of being set up by the ADOC, everything being in a planned state. This is really, in essence, the resident arriving in the home. Welcome. The next portion is going to be the admission. And this starts with the resident arriving, and report will be given to the nurse on the unit, who will receive report from the sending clinician. And we want to talk about the admission coordinator. the resident's going to arrive, the admission coordinator is going to be notified, and the admission coordinator will then notify registration to update the pre-admit encounter to the full admission. So that'll be done by the registration clerk, the front office, business office, or the social worker, and we're going to go through that now. So if you'll recall from our pre-admit workflow, if we look at our resident list, there's a few ways we can see who's coming in. We can look at in this situation, we can see that we've got residents not admitted to Montreal 3, but not in a bed. So our demo has been so far with ZZZ Test, PCP, Providence Care, Providence Manor Working Group, and we have this encounter here. So it's going to require opening up the registration conversation that we looked at earlier, which is in the toolbar here. So we'll go ahead and open that conversation. And we'll have an opportunity here to select the conversation that we'd like to use. In this situation, in this example, we're going to use the inpatient registration. We're going to select that, double click it to, again, this person search. And so we can use a few identifiers. We could use the MRN, we could use the name. And for this demonstration, I'm going to use the name. And when we search that, we're going to see encounters. With what you'll see in real life is going to be a listing of several encounters. And as Lumio is activated and continues to go on, residents that come to us at Providence Manor will likely have had many visits in different departments, different organizations within Lumio. So it'll be really important to be mindful of which encounter we select. So we can always expand this person search to see more values and more information. We can see here that we've got the facility of Providence Care, Providence Manor. We can see the MRN. We can see the encounter. We can see the patient type, which is important to see the pre-admit. And we can even see that expected date of arrival, which we had populated in the past. And then you'll see in other encounters, discharge date. And of course, we'll see our medical service of long-term care, the location, and the reason for visit. So for this demonstration, I'm going to go ahead and select this encounter here and select OK. The registration conversation is going to open up. We can expand that. And all of the work that we had earlier invested in the pre-admit encounter is going to carry forward. So we can go ahead and confirm the information here and update as required. We can see the patient address carried forward, as well as the preferred phone number. We can update these values if required. The risk information is not required, but we do start to see some new required fields in this general registration. What language did you speak as a child? It's important to know that these elements will also flow forward into our RAI assessment and what interfaces to Med 2020. So these values are really important to have as accurate as possible. Again, we'll see that health life, the encounter information we'll see as additional values are available now. So we had initially the pre-admit, which allowed us to select the facility, the building, the nurse unit, the unit description, and now we have this thing to show us the bed availability. So we can go ahead and open that up. It's going to open on my second screen, of course, and we'll just drag it over here, and I can expand my list here, and we can see now all of the beds that are available for us on Montreal 3. It could be that we've had a predetermination of a best location for this resident, or perhaps we're just finding the best available bed. Let's go for the end of the hall, possibly. Anyways, Montreal 365, we're going to select, and I'm going to hit OK. So we can see the room's been selected, the bed, the assigned accommodation, the preferred accommodation, and the accommodation reason. We're going to go ahead and just select as requested. We have the previous patient type, which shows here. The patient type is available here, and off service, we're going to say no. The service of long-term care is here. It's important to know that your two respite beds will have two service types. One will be long-term care and one will be respite. For the rest of our beds, they will only have long-term cares available. The bed service and the subspecialty and the testing and the reason for visit is here. Again, we did admit. The admit type is elective scheduled. The admit mode, we can go ahead and say ground ambulance, perhaps. The admit source, we can have as a direct admission. And again, we had a nursing home as a location, and this example that I had selected for this demo. The registration date we want to do today, and we're going to pretend that the resident arrived at noon, right on time. All right, and we've got our attending provider, which if things have changed, we can go ahead and change those at any time, not just now, but also at other times during the resident's visit. We've got the contacts, and we can see there's a guarantor relationship to the person. I'm going to go ahead and just select the alternate contact to facilitate our process here. And you'll see that it'll allow us to select someone that we've already entered in the residence registration process. Okay, and we're going to go ahead and we can review that primary insurance again. Under secondary and tertiary and additional insurances and insurance summary, and again, the alerts. All right, we're going to go ahead and select OK. The next thing we're going to see is a pop-up box once we finish registering somebody. This is called the document selection window, and we can see here a few things. The admit notice, which is going to be a single page, the Lumio adult armband, which is going to print an armband, the Lumio MRN and Fin sheet labels, which will print one, and the Lumio demo labels. These are armband, but allow for sort of sticky or adhesives to be placed on the Paperlike chart top right corner, for example, which would include the resident's name, the Fin, the MRN, the date of birth, etc. And we should see something called a face sheet that will come out, which is the patient demographic record. And it will have information about the resident, their emergency contact information, their address, etc. And it's usually recommended to place that on the Paperlike chart. So in this, it seems to default to do not print documents. If we were to modify this, we could choose and update how many labels we want to do. For example, perhaps 15 is not quite enough and we need to update that. We should be able to update that to whatever number we're looking for. So we'll see that pop up here with the printer that we can select, as well as the number of copies. In this example, I'm going to return back to do not print documents, and we're going to select OK. The next thing we should see here is, after I refresh our screen, the resident is now in a bed. And we can see that the resident's indeed in the bed. So we've got the date of birth, for example, the admission date, as well as the resident's been in the bed for 0.3 days. So next we have that the front office, business office, or the social worker is going to complete the contract, the resident's rights, the consent to treat, and other paperwork per facility, a policy and procedure with the resident and/or representative. The paper forms will be filled out and signed and then scanned into PowerChart. So there will be a quick reference guide on how to do the scanning, but here we would open the residence chart. And the next part of the workflow, which is pretty exciting, is around uploading or taking the resident's photo. So you have an opportunity to do that in a couple of ways. The most straightforward way is when the residence chart is open to double click on the resident's photo and to either browse a secure device, such as your resident's photo on your P drive. In my situation, I've just got a photo that I've got copied onto my clipboard and I'm going to paste it. And from here, I'm going to go ahead and confirm. And I chose a photo of people putting the pieces of the puzzle together, as indeed admitting a resident takes the team effort as everyone assembles the puzzle to each complex resident that we get to work with. So once I've confirmed that, we can see that it's immediately available in the banner bar, whether I refresh or not. And this will be part of positive patient or resident identification for medication administration and other workflows. I think a nice part about this is you'll see in the multimedia manager that information is available here as well. And we can see that it's at the person level, the person photo. So when our resident goes to another facility, that photo will be available for others to also identify and to help identify the resident, which I think is quite helpful as well. So that ends the element for our front office business and the social worker, where we've covered the pre-inpatient admission, creating the pre-inpatient encounter, followed by flipping or converting this to an inpatient visit. And one thing also to include is in the orders section, there's some automation that happens when the resident is admitted into the bed. The system is designed that it triggers a new admission rule, is what it's called, when the resident is registered net new to a long-term care resident inpatient visit. The system is designed at this time to place a few orders on the resident's chart. And you can see here that they're order entered secondary to the inpatient admission. We can see the adult patient history is ordered, and that will task to nursing, and it will have a form attached to that task. The resident height, the resident weight, both of these things will task to the PSW, and we can also see the frequency is Q1 year for the height, and for the weight is every 30 days, as well as at the time of the admission. And we also have the vitals LTC, which is going to be tasking every 30 days. And again, it'll be tasking to our nurses. And that kind of wraps up the demo for our front office here. And next we'll pivot to the next member of the team in this demonstration of admitting a resident to long-term care. Okay, how's that? Any questions on the reg piece?
I think we need to have Jody trained for this.
Yeah, for sure.
Yeah.
And I did go slow, I think, to support that. And I will meet with Becky on Friday to get some, like, probably chopping up the video a bit would probably be helpful. And then they could use these videos is what I was thinking, Caitlin. And yeah.
Okay. Thank you.
Yeah, no problem. Harmony, did I miss anything? Or Laura?
Nope.
Some people, we have Visios as well. I guess they're workflows and workflow designer, Caitlin. I don't know if those are handy for you. Sometimes my experience has been, sometimes we like it clinically and sometimes we hate it. Sometimes it makes sense. Sometimes it's like not helpful, but we have those as well to accompany this, and that's what it follows. And then it marries what Harmony and Young Lee have taught as well, so that I'm not teaching something different or showcasing something different. Go ahead, Laura.
I was just gonna say too, I would expect that we will be uploading these to the Lumio library, correct? And Jody was invited to this meeting, but it still gives her an opportunity to check it out, which is kind of nice having that Lumio library as a repository for all of the work that Sebastian and team have been doing.
So, all right, we'll roll into the next one. Next one's nursing. We're going to continue by exploring the nurse's role in the long-term care new resident admission workflow. So far, we've covered that the front office business, the business front office, and the social worker will create a pre-inpatient encounter for our long-term visit, including updating the contact information next of kin for the resident, as well as creating a message and message center that the team will be able to see. We also covered that the ADOC will start and initiate the creation of the 24-hour care plan, leveraging the CRIS system as they get to know the resident to match the suitability, etc., where the ADOC will place IPOCs, interdisciplinary plans of care, part of the care planning solution in Lumio, as well as placing the point of care order set in a planned state to be leveraged and reviewed by yourself as the nurse completing the admission. We also then have that when the resident arrives in the building, that the front office will then convert this pre-inpatient encounter to an inpatient encounter. Complete the contract, the resident writes the consent to treatment and other paperwork for policy and procedure, and they will also update and upload a resident photo that'll be visible in the banner bar. Next, as the nurse, you'll have received report from the sending clinician sometime along this journey and learning a bit more about that handoff information from the acute care location or possibly the community location which the resident is coming from. It's important to know that right away the idea is to get into the chart and to start to get those care plans running to support our PSWs. And so we're going to start by opening up our location list. In this case, our resident is located at Montreal 3. I'm going to double click on the resident's name. We're going to have this assign a relationship and declaring our relationship with the resident. We're going to select long-term care nurse. And into the chart we go. Chart over here, and we can see our resident photo. We can see in the banner bar important information. And what we're going to look at here is quickly initiating the point of care order set So we can see here that the LTC point of care order set is in a planned state. Our ADOC has done a lot of work in terms of customizing this to meet the residents' needs to try and set it up for success. So we can go ahead and we're going to review these orders. We can see on the left-hand side the orders that are selected. And based on your own care planning, you may decide that you want to update, modify things, etc. We can hover to discover in most elements of PowerChart. So the personal hygiene elements that will display for the PSW, for example, in this personal hygiene order, it's going to task at 0700 today. So it'll generate actually an order and a task that will fire for the PSWs to manage retroactively for today in the event that we've got into this work a little bit later in the day. The personal hygiene that'll display in Care Compass to support the care planning and how to take care of the resident will display in the task as well. In this situation, the order comment will help to define that the resident will be total dependence and require a 2+ person physical assist. So it's strongly encouraged that you review things like when is the bathing schedule going to be and update information like that. So if the bath day is going to be starting perhaps on Mondays, and if we're going to have our bath time set for 10, we want to update a few of those elements to make sure that the orders are going to fire the way that we want them to. And perhaps our second bath day is going to be on Thursdays, and we'll have our first bath day later this week. And again, if you don't see the information in the special instructions, it's going to be here in the order comments. So again, tub, shower, bed bath, total dependence, and staff of 2. So again, you want to review and customize these point of care orders. And when we're feeling like it's ready to go, we're going to go ahead and right click here to initiate now, or bottom right hand corner to initiate now. I'm going to go ahead and initiate now. And we're going to see there's a light bulb here that tells us that it's pending. We're going to see these light bulbs to tell us that these are the orders that are going to be activated. And we can also continue to look at the rest of the care plan that the ADOC has set up for us. We can see here that the LTC activities IPOC has been set up for us, as well as the LTC ADL functioning IPOC. So we can go ahead and we want to confirm these elements. Perhaps we need to determine additional goals and interventions and customize them here before we initiate it. So we're going to determine the favorite recreational activities and encourage involvement. We're going to increase activity levels gradually as permitted based on condition, etc. And of course, you can always select any of these patient-specific interventions and modify them to customize them to be what you need, what you would rather see in terms of a goal or an intervention. So once we've gone through and we've got this with the light bulb, we can say that the activities is looking good. We're going to initiate that now, and we can look at this main IPOC with several sub-phases to it and go through each one and initiate them as we see they are set up for us. So in this example, the walk-in room, walk-in corridor is not going to be something we're going to be care planning towards. Locomotion on unit, perhaps we want to add here, and perhaps we need to include the extensive assistance or even total dependence determined based on what your clinical needs are. And once we've gone through and updated these IPOCs, we are going to go ahead and select the initiate now. And we're going to hit this orders for signature, which is going to put all of these things in a list for us to review prior to signing. So we can see here, once I've hit that we can see these care plans that we've put together, the status that they're going to be initiated. We can see the details of how many orders are within it, and we can see the breakdown of what these look like. So these are the patient care orders that are found within the LTC point of care, and I can find that by hovering over the pizza box, and we can see here that the LTC point of care is selected. So it's important to know that these orders will create, based on the frequencies, tasks that go to the PSWs for them to support their documentation, which closes the loop in your care planning. If there's anything that I want to modify here that I may have forgotten, we can reset and go back and fix and modify them, or we can proceed in this example of just signing. And we're going to want to refresh once we've done that. And now we're going to see our LTC point of care order set initiated and in bold, as well as some of the care planning elements. The next thing I want to demonstrate is moving to, under the menu here, the LTC nurse view. And from here, we're going to see the admission MPage, workflow MPage, and we're going to start from the top. And we can start from this immunizations component, and we can go ahead and document. We can order an immunization or document the history. We can also document not given. And these are good examples of if an immunization is ordered and it displays on the MAR, and something is refused during the time of administration, it will update this control to say that the resident refused the tetanus shot. Or if we want to document history of their past COVID-19 immunization, we can do that quickly by selecting it here. And we can determine the sources as well. And submit. And you can always refresh an individual component here or the entire page. Sometimes it's easier to refresh the component if we've only updated one element. This information, called the immunizations, will follow the resident across their journey. So as we provide immunizations in the home and do the analysis and documentation in Lumio, this information will follow the resident to an acute care visit, an ambulatory visit, as long as they're within Lumio. Next, we're going to look at contact information. And if you recall from one of our past demonstrations, we had our front office, the business office, update physio as an external contact. It could be at any moment in time that we determine we need to update contact information. We can go ahead and do that from here, and it will carry the information that was documented in the past into the form to support the ongoing capture of information. So it could be that we've got some more information about the substitute decision maker that we can put in here. In this example, I've just put in spouse, Mrs. Working Group, 123 Waterway, and a phone number. And we can go ahead and sign that, and we'll see the power form close, and automatically or by refreshing, we'll see that contact information will be updated here. So we can see the substitute decision maker information is here, as well as that external professional contact. So we want to update that contact information as we get more information. Next, we have custom links, and I can drag and drop use components in here if I want to change the order. We have custom links, which support some assessments. Next, we're going to look at something that was part of the admission order set, which we talked about when the resident is put registered into the bed. We can see a few things here. These are the patient care orders, and I just wanted to show that we have the adult patient history, which is placed on the chart by through automation on the admission. That's going to task us as in the nursing position. I'm logged in as the long-term care nurse. I can access that from Care Compass, that task, or this activities and interventions. For this demonstration, I'm going to come to the activities and interventions. I'm going to double click on this task. There's another way to go there from the LTC nurse view or from ad hoc by building a new form. However, the system is not going to know that we created a new form. And the task will stay persistent or stick around. So for this demonstration, I'm going to double click on this task. So once we've done the documentation, the to-do goes away. And from here, we want to fill out as much as possible, going from sec tab to tab. And we can see these boxes and information here. An important thing to note is the infectious disease has a red star next to it, which means that there are yellow boxes, which are mandatory fields, which means we won't be able to close this off until we've addressed those. And we'll just do our best going through the interpreter services, the advanced directive and information that's here, the infectious disease, which we looked at, nutrition, the psychosocial, spiritual, family history, social, procedure, problems, educational needs, visitors, or designated rather, support person, care partner visitors, and the CHOBIC, therapeutic self-care. When we're done and we filled out as much as we can, we're going to go ahead and select sign. And we'll see here that in our task, which is in activities and interventions, which we would also see in Care Compass for the whole grouping of residents that we're caring for on Montreal 3, that this task is finished. When I refresh, it's going to go away. I'm going to go back to our long-term care nurse view, our admission documentation component here, and we can refresh that. And we have some information from the admission documentation that's showing up here. This is designed across Lumio to display information across different care areas that have been identified as being important for those care venues across. We can see here from this drop-down caret that admission history adult is here. And we can also see the valuables and belongings. It's important to know that the PSWs will complete the valuables and belongings moving forward using Lumio. They have a similar, the same admission workflow MPage and the ability to get to this component as well and this form. The next thing that we're going to look at are allergies, and I'm going to move that up in my list here. And we can see here that in the banner bar, allergies not recorded. We can see a really strong visual reminder that allergies are not recorded at an allergy. There are a few things that we can do here. We have something for no known allergies, no known medication allergies, and we can add allergies here. If, for example, the resident is allergic to watermelon that we discover while discussing with the resident, we can select that, and we want to include some elements such as the severity. Perhaps it's moderate. The category we want to include is food, and we want to search for reactions. Perhaps anaphylaxis, perhaps, or maybe not quite moderate. And we can add more than one reaction, but perhaps I'll update our severity to severe if we're anaphylactic to watermelon. And we can have things as status as active or resolved and the reaction type. And of course the source. And if we know an onset, we can go ahead or add additional comments. And once we're done that, we're going to hit save. And we're going to close this. This is just saying that it's a non-multum allergy. No interaction checking is available. Multum is a drug catalog, and there's an opportunity for drug and allergy interactions to be checked. So it's giving us a little disclaimer there. So now we can see here, if I refresh, we'll see watermelon now displaying in our banner bar. For the allergy, that allergy will display on Care Compass when we hover over the resident's name, and this allergy will follow the resident when they go to hospital as well and come back and the list is updated. Next, we're going to look at documents, which I'm just going to move that component up next. And we can start to see here that we have different documents visible. Important to see we have all visits. So this will be important from a nursing perspective where you will get to see the documents crossing different encounters. So if our resident has come from KHSC, you'll get to see their emergency room admission, their discharge summary from the discharging provider. All of that information will be visible for you to review. You can also change the filters the last 48 hours, 3 days, 1 week, 3 months, 6 months. You can also change filters here to show provider progress notes, etc. And last 50 notes, my notes only, or even group by encounter. So by doing that, we can see the encounter displays here. And we can see stuff like our admission history adult and how that information is displayed here from our power form that we've done. You can also enable continuous scrolling, which will allow you to kind of go from note to note. We can see here the reason for visit is not populated at this time. The goal of care, which we've documented, also displays here and under the goal of care. And we have the histories, problems, family, procedures, and social. So these are controls which follow the resident across their journey. And the care team is around which providers have relationship with the resident across their care journey, and implant history as well, which will follow the resident across their journey. These elements can be added from the diagnosis from the histories control here. Social controls and procedures. Returning back to the menu here, the dark blue menu, we've got the LTC nurse view. We've looked briefly at orders, which displays the point of care order set, the IPOCs, etc. The next thing that we're going to want to talk through is the addition of the long-term care admission order set. So we're going to continue to have the long-term care DigiPen workflow. Once we've received our admission order set from our admitting provider, we're going to want to transfer. I think my turkey soup or my monotone voice is making me sleepy a little bit. Are you guys okay? Any questions?
Yeah, I just have a question with regards to the history under and it says something about problems.
Yes.
Is that the diagnostic one that's assigned with specific codes?
ICD-10, do you have the diagnoses and problems here? Yeah, this is all ICD-10. And
So the problems under history, which ones are that one?
these are different things. Problems, family, procedures. So this is, no, you're right. Problems is here as well. Yeah. And then family is like historical stuff, like history of colon cancer or breast cancer or whatever kind of a thing, from like sort of a longitudinal thing and the ability to track things. So like that's a control that's in Lumio or Cerner. Procedures as well, appendectomy or tonsillectomy, adenoidectomy, whatever. That sort of stuff gets done. In the operating rooms when they do their things through Drager and through their other interfaces, those will automatically update as well. And then social is stuff like smoking history, alcohol sort of history, sexual history, that sort of things comes through that. Yeah, and then the problems would be this as well with an interplay to the diagnoses and problems.
So there's another spot for diagnosis and then another spot for histories. Like,
Yeah.
Okay.
Yeah.
Thank you.
Yeah, you're welcome. The residents across their journey. Implants. Social controls and procedures. Returning back to the menu here, the dark blue menu, we've got the LTC nurse view. We've looked briefly at orders, which displays the point of care order set, the IPOCs, etc. The next thing that we're going to want to talk through is the addition of the long-term care admission order set. So we're going to continue to have the long-term care DigiPen workflow. Once we've received our admission order set from our admitting provider, we're going to want to transcribe that information into Lumio. So we can go ahead and search for the LTC admission order set. From our scratch pad, that's going to open up here. We can go ahead and select our diet. If it's known, we're going to go ahead and update the resuscitation status. We do have resuscitation status as part of the workflow for our long-term care providers, so they'll be trained on that entry. Some orders such as verifying consent on chart, the communication orders that are available as well. Part of your standard admission order set are all here. Once we've added that, we're going to want to hit the orders for signature and of course have crosswalked what was placed using the DigiPen workflow, and that allows us to deselect elements if required or add additional things if required. We're going to want to enter the name of our ordering provider in this situation, and the communication type we will want to select as paper or fax because it's coming from that DigiPen workflow. Sign that. It's giving a summary of what we're ordering. And we're going to refresh our orders page here. And now we've got our admission order set, our long-term care point of care orders, and our care plans that are all placed on the order in the residence chart. So that's the orders piece under the menu. Next, we're going to look at documentation. Documentation. Okay, just being mindful of time. that might be a natural break for us to stop. And from here, we go into documentation and reviewing elements in the menu and how to create a note and how to create a favorite note and stuff and use templates as well. But this might be a good natural opportunity for us to wrap up so we don't go over.
Mm-hmm. Yeah, nothing for
Um,
me.
Okay.
I'll go back to sharing our agenda. And once again, thank you, Lizetta, for helping to create this. So our last topic, and I don't want to say last but not least, because I think it's an important one. The first bullet is select a local chair. So Caitlin, I don't want to put you on the spot, but we will be looking for a co-chair. And I don't know what your thoughts are about maybe putting your hand up. I know I'm going to put you on the spot a little bit. But we don't have any meetings coming up for the month of December, but come January, we're going to need somebody really filling that position that's tied into leadership and plugged in with Harmony and the team to really help to stick handle that. I don't feel the commitment is really that onerous. I could be wrong. We usually have an agenda setting meeting, which is a half hour, and it's really bringing anything that you might have from the home that you want to discuss and that I might have from operations that I'll need to talk about and discuss with you how we are going to come across with the joint approach on it. And then we have the 1 hour meeting. I suspect that I will be the one doing the meeting minutes because we will be having Lizetta go back. But again, I don't think it's going to be a huge time commitment. I think time commitment that is really the bigger part is that change champion, and you're already plugged in and doing that. So I do want to kind of not only plant the seed, but kind of start the little seedling going on that.
You should work in
because
collection agency, Laura. I'm gonna put myself on the co-chair. That's fine. Yeah.
Thank you. I appreciate
It's official.
I didn't have to do too
It's
much begging
official.
or something. Well, it is really appreciated because we will be losing Sebastian and a lot of the resources. And I do want to make sure that I'm still plugged in to LTC. And, Harmony has my cell phone number. Again, if you have anything that pops up, reach out. Especially, I think it's going to take all of us to kind of navigate the waters after go live. So that is awesome. Thank you so much, Caitlin. That's music to my ears. So then I will give the last agenda topic back to Sebastian because I know we do have a little bit left of the video that you had started, but
Yeah, I don't think we'll finish it in 4 minutes or a few minutes here. We've got another 15 minutes left, 14 minutes, 30 seconds left in the video. And then I'll work on building our next portion of the workflow as well, and the videos as well, which I think will be helpful. It'll be nice to see the provider build as well for everybody. It's always nice to see what everybody else's build looks like to put the pieces together. And I think it'll take us one more to get through the admission is my hypothesis here. And then after that, we can look at the next workflows to demo and share if that works for everybody.
Well, and hopefully we can get some built-in advance that we can use in our back pockets for January if need be. But I think if you're right, if we have some built out that we can even add to the Lumio library that you feel or that the team feels, we're running out of time. Our roadway is getting much, much shorter.
Yeah.
And lots going on, especially with cutover and, loading our patients and getting the medications. Like it's going to get really hectic, I think, pretty quick. But, we'll, I always think with LTC, we're better together.
100%.
So I think that we'll make it through.
Yeah.
And Lizetta, you have your hand up.
I was just thinking, since Caitlin has kindly volunteered to be our co-chair, would it be a good idea to maybe, because we don't have any meetings in December, invite Caitlin to some prep meetings so that she gets a flavor for what we do in those prep meetings?
I think that's a wise idea. We probably only have one more prep meeting because, oh no, I guess we've got November.
Yeah,
So
we got
yeah, I
November.
think that's a fantastic idea. I think that's a
Yeah.
fantastic idea. As long, and would that work for you, Caitlin? And
Yes.
you may not be able to understanding. I know how busy your calendar is. We've had, Harmony broker some time in the past to nab you. So we can aim for those, and that would be awesome. That would be awesome. Alrighty. Well, we're finishing off 2 minutes early. Unless, Sebastian, is there anything else that you can think of at this point?
No, I don't think so. I think having Caitlin come to the pre-meeting is a really wise move. And I think, with Harmony being really close to the work that we do and Laura being on the ops side, like you're really setting things up for success. And yeah, to your point, Laura, it's going to get busy. It's busy already. But yeah, no, I think that's a good way to set things up, and it'll give you an opportunity to be, I think, in a bit of a routine here as well. And then with the activation, I'm sure with the Go Live, they're going to have some sort of a structure around like placeholders for emergency meetings. And it'll be important, Caitlin, to know that like it'll be important to get to those tables to make sure we're not having. I'll give you an example. We had our nursing administration window. There's a rule in the system that's set that you can give a med 60 minutes early, 60 minutes late, or whatever, something like that, or 120 late.
Yes.
Things like that might impact us during our go live, and it might have a relationship to how the medication was entered by retail pharmacy because it enters at different standard admin times. But that the amount of clicks that the nurses have to do is significant. And if other members of the Lumio team, for some other safety reason, decide to crunch the window down, that would have a direct impact on us, as an example. So it'll be important to know that these tables are happening, that there's conversation at these tables that are happening, that will need representation, so we don't have people making decisions and affecting us daily or on our build, at which you'll hear about it the next day, right? And then
Yes.
and the change process will be that they'll have to do a change in the non-production domain. They'll have to validate it. They'll have to have a communication, most likely they're going to send out at an enterprise level. And then when the change comes into production, there's usually a reversal process to reverse changes, but at that time it's out. So it'll be important to get into it early on and understand which tables to be at, or give your regrets. There's usually a way in the terms of reference, like if you can't go, you could delegate someone else, you can assign them a proxy, all of that sort of stuff. And you'll just want to just be mindful of that as we get closer to the go live. That's what I'm imagining forming if the working groups are able to structure themselves and go on that path, or some other path, of course, as well.
Well, and to add to that, Sebastian, and I don't want to keep anybody because we're 401. I have found through the ops team, the stronger working groups are those that have the regional co-chair in place. They seem to be really really well run. They have the buy-in of the groups. And I think it's just that extra leadership in the region that sometimes it's hard to, push forward with. So I think that having you on board earlier and part of that whole dynamic change process that Sebastian's talking about, I think it's much better. I think it will be better for it. So again, thank you.
Yeah. All right.
Alrighty. Well, I will wish everyone a wonderful evening. We have sunshine. Hopefully everybody will be able to get out, at least on this part of our country. Sebastian, we have sunshine. Hopefully you've got some as well. We had rain earlier, so we'll push the sunshine your way. Enjoy
Sounds
your
good.
evening.
Bye,
Likewise.
everyone.
Thank you
Thank
so much.
you.
Bye, everyone.
Bye for now.
Bye for
Bye.
now.